Hey everyone, Tyler Grant here with Dynamic Training Strategies, and today what we're about to go over is what's inside my medical bag. Let's take a look.
Let's go.
So in no particular order, we're going to open this up. On the outside, you can see I have some shears. It's on a breakaway chain. So if I need to go up to someone, I can break the chain, start cutting away, start cutting off clothing, cutting seat belts, what have you. If you go on the inside of the lid, I have a little flashlight, some hemostats, not really worried about that, and a window breaker, and a seatbelt cutter. Awesome, right? So I can go up to in the vehicle, break a side window, and cut seatbelts off if I need to. All right, and let's go from front to back. All right, I have nitrite gloves. You need nitrite gloves if you're going to work on anyone, especially if they have any type of body fluid coming outside of them. You need to protect yourself. You need to have proper PPE. And let's go to this pouch right here. Oh yeah, it's all my coagulants. All right. So we have Celox A. We have 2 forms of combat gauze, and we have Halo chest seal. All right. This stuff's really good. I like the Celox A. This is in the syringe type applicator. So if it's like a really deep wound, I can put the syringe together, put the thing in the thing, push down on the syringe as I pull out to fill from the bottom up, and I would pack it. All right, this is, just for any type of wound packing in general, okay? Now, I have 2 triangle bandages for mainly just slinging and swathing. I have some just gauze and some tape, some gauze sheets, the rolls, and I have some ACE type bandages, okay? Got a blood pressure cuff and a stethoscope. This may not apply to everyone. If you know how to work one of these, it's awesome. You can get a blood pressure on someone and know if they're shocky or not, besides just if they're cool, pale, diaphoretic. So I like these. I got this one from CVS. It's worked for me just fine. And you want a decent stethoscope. The kind you get at CVS, and the pack that comes with the blood pressure cuff, they're garbage, okay? And look at this back part here. I got 2 Curlex rolls, all right? I got 3 H&H compression gauze for wound packing. So if I'm gonna use one of these, I'm gonna put this down first and use as much of this as possibly can, and if I need to, I can always go back to the Curlex rolls for wound packing as well, all right? I have 2 Israeli bandages. They're not my favorite ones, but hey, I got them. I'm gonna use them until I replace them. Then I got some 2x2s and 4x4s, just for any small cuts, lacerations, things of that nature. And I got me a sand splint. If you know how to immobilize a joint, awesome. If you don't worry about it. I'd rather you hold whatever is injured with your hands to keep it stabilized versus one of these, because you can move around the joint quite a bit with a sand splint. And it takes a lot of time and practice, to get good at one of these. All right, but hey, let me bring up a point real quick. You need to know where everything is at in your medical bag, if you have one, so you know exactly where everything's at, and when you're helping someone, you can just open it up, grab what you need, and you're done, instead of opening it up, searching around what you need, and trying to help someone as well. When you understand and know where everything's at, it becomes automated. You open it up, and you're not have the external stress of searching for searching for an item that you need, the patient needs, the person trying to help needs. It just gets rid of the extra stress, all right? So let's look at this side pouch right here, move my shears out of the way. So if I'm gonna help someone that's coughing a bunch, if they're just coughing a bunch, boom, I'm gonna give them one of these, masks. If they're coughing a bunch, and I picking up signs that they may have meningitis or they have hepatitis and they're coughing a bunch, I'm probably gonna put one on too. All right. One thing I probably need to put in here is eye protection. That's not a bad idea. Also, with that in here, I have my biohazard bag. So if there's stuff, maybe a body part or a lot of soaked rags or shirts or anything that has a lot of the other person's body fluid on it, I can put it in here. I can give it to EMS. They'll take it to the hospital. They take care of it for me. Makes it super easy. And this one, this side pouch, this is what everybody's talking about in the shooting community. And I don't want to seem I'm anti-tourniquet, which I am clearly not, because I have a bunch of them in here. There's more to medical than tourniquets. I hear a lot of guys talk about tourniquets. Tourniquets are awesome. You need to know how to use them, but let's expand our knowledge on the medical side more to just tourniquets. I got a cat tourniquet, as you saw, as I pulled it out, it opened right up. Okay, and I'm gonna go further into tourniquets in my next video. Okay, I got a cat tourniquet, I got a soft T tourniquet, and I got one people are probably gonna frown upon or love is the rat's tourniquet. All right, I have that set up in a special way, and again, I'll go more into it when I go into the tourniquet videos. Okay, I have a SWAT T tourniquet, and I have what I like. Pressure bandage I like the most is the H bandage, and I feel comfortable using that as a hasty tourniquet. So that's what I have in my medical bag. How does your bag look different? Tell me down in the comments below. If you thought you were going to see something and you didn't see it, let me know again down in the comments. If you've been following me, you know I'm an EMT now, so I have more things in here than maybe the common lay person would have. More than just having a 2-day medical class. What you have in your bag, tell me what you think I should have in here. If I have way too much or not enough, just tell me. All right, guys, I'm Tyler Grant with Dynamic Training Strategies. Stay safe. Can't wait to see you on the range.